Hi, my name is Ronak Patel and I'm an orthopedic surgeon specializing in knee injuries. I'm going to talk to you about the ACL repair with the Bear Implant. Historic methods of attempting to repair or suture an ACL ligament that's been injured have failed. Whether that's using strong suture material or other synthetic materials, the body lacks the ability to heal the ACL. The Bear Implant is relatively revolutionary in this. It's a biological scaffold, which is a bovine-derived type 1 collagen implant. This implant is placed between the native injured ACL and the bone and serves as a bridge-enhanced ACL restoration device and technique. This allows your body to heal the original native ACL ligament. We've performed many Bear ACL repairs. Not everyone is a candidate, however. In order to ensure you're a candidate, we would make sure to look at your MRI, find out the date of injury, and assess your overall ligamentous structure and laxity of your knee joint. If you're interested in the Bear technique, we advise you to come in and consult with us sooner than later, as there's a short window in which this technique is an option for ACL injured patients. I look forward to meeting with you.